Trump just handed over your healthcare to the same tech giants who censor your social media. But this time, they're deciding if you live or die. And we're going to get into the story that no one is talking about. But first, some background, starting with Medicare. And as if Medicare has not been through enough this year. And if you've been totally zoned out this entire year and missed the whole big ugly bill thing, I'm jealous. How does it feel to feel joy? The big beautiful bill was passed earlier this summer, gutting Medicare, gutting Medicaid, food assistance program, which will kill millions of people, so that way we can give a little tax breaky to Trump's billionaire donors. Billionaire donors who do not know your name and do not care if you die uninsured. And now the latest attack proves that Trump would rather trust Silicon Valley billionaires than your actual doctor when it comes to your healthcare. And it's definitely more disturbing and flying completely under the radar while everyone's distracted by his latest antics. The Trump administration just announced a new pilot program that fundamentally changes how Medicare works. And when you hear what they're actually doing, you're going to understand why they buried this announcement on a Friday afternoon. To give some more background, for 60-something years, Medicare has been quite simple. Original Medicare works like this. You're covered, your doctor decides what treatment you need, you get that treatment. There's no corporate middle person, no profit standing between you and your healthcare provider. That's completely different from those Medicare Advantage plans that you see advertised on TV. Those are private insurance companies that contract with the government. They make money by finding ways to deny your care, networks that you can't leave, prior auths that change everything in like a constantly evolving plan. Original Medicare was much more straightforward. And I mean, as straightforward as medical care can be. If your doctor says you need this thing or you need some sort of treatment, Medicare would generally have it covered. The decision on your treatment plan was made by that doctor. And we know Medicare Advantage plans have been a disaster for seniors. Private companies figured out that they could take on government money, promise the world to sick people and do it so in slick commercials. And then they use AI and bureaucracy to deny people care when they actually get sick and need it most. The beautiful thing about the original Medicare is that it was avoided. It was able to kind of skirt past all this garbage without networks or prior auth algorithms deciding your fate. Simple as healthcare can be, relatively reliable, or at least kind of mostly transparent coverage. The Trump administration looked at this broken private system where companies profit by denying care to sick people, and they apparently had an idea, you know what, that original Medicare needs? More of that corruption. And Trump went out to create a system where big tech companies make more money every time they say no to your medical treatment. And this program is going to start in 2026. This is the one part of the American healthcare that actually kind of worked for seniors, and injecting it all with poison that makes private insurance a nightmare. They're calling it wasteful and inappropriate services reduction program. What? Sounds reasonable, right? Like, who doesn't want to reduce waste? But no, this is literally importing the worst features of Medicare Advantage into the original Medicare program. Red tape, algorithmic denials, and profit that rewards people saying no to your treatment instead of actually helping patients. And this is starting in 2026, just a few months away. 6 states are going to become testing grounds. For the first time ever, the original Medicare patients will need prior authorizations for certain treatments. Private contractors will review those requests, aided by none other than AI, bots, system designs to flag claims for rejection. And here's the kicker. These contractors make more money the more they deny you care. Don't take my word for it, because in a minute we're going to hear what Stacey Abrams had to say when she learned of this program. But before we cut to the clip, I'm going to ask you to take a moment to check and make sure you're subscribed. Leave a comment and let's cut to the clip.
Trump and the Republicans quietly created the first wave of death panels. I'm not being hyperbolic. They are launching a pilot program that uses artificial intelligence to decide whether Medicare patients get certain treatments. That means an algorithm, not your doctor, can say yes or no to care, to lower quality of life and the potential of inadequate medical treatment. But unlike the histrionics around the Affordable Care Act, private tech companies will actually get a cut of the money they save by denying treatment. The more care they block, the more they profit. At the very same time, Elon Musk is rewriting his AI chatbot Grok to parrot right-wing talking points. That's the same AI that spit out Nazi slogans before he pulled it back. If you've read my latest novel, Coded Justice, you know this is dangerous. When algorithms become the tools of autocrats, they become weapons used against the people. Medicare is our nation's promise to our elderly. But under this authoritarian regime, guaranteed healthcare for seniors is being secretly morphed into private insurance that can discriminate, and truth itself is being rewritten through algorithms. It's dystopian, it's wrong, and it's already happening in the pilot states of Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. This is step 7 in the autocrats' playbook: weaponize technology to strip away rights from the vulnerable, to control what people believe, and decide who counts. If we stay quiet, it won't stop with Medicare. It's another step towards autocracy, and our health and our democracy are on the line. So speak up.
We are in a Black Mirror episode. They're breaking the one thing that actually kind of works. Original Medicare was the promise that if you paid your whole life, healthcare would be there when you needed it most, without bots, without AI deciding if you deserve to live. Trump just handed that over to private contractors and told them, hey, you can actually make more money by saying no to sick seniors. Silicon Valley now gets to decide and profit off of who lives and dies in America. This is denial-focused business modeling, and it's going to kill people, and people will profit from their deaths. The rich will continue getting richer, not only from exploited labor, but now from saving money by denying care to seniors that need it most so that way they die. This will be rolled out nationwide. And once these incentives are hardwired into Medicare, they will be nearly impossible to remove. And they're not going to stop at Medicare. Welcome to the end of Medicare Promise. It's no wonder Trump hosted this Last Supper style dinner with all these billionaire tech CEO bros, because now they're not just coming for your data, they're coming for your life. And more important than our tax dollars being used to fund billionaires, they're now being used to fund killing seniors. Subscribe if you want to stay ahead of what Trump's attacks on your healthcare actually look like. I'm Lauren Paritra, and I'm glad to have your support. I cannot grow without you. Please share this video with a friend if you resonated with it or if it expanded your perspective. Follow me on I Am Lauren P on social, and I'll be back with some more.